enable.
Diabetes, it's a disease that's often called the silent killer. In India alone, almost 69 million people are battling type 2 diabetes, and yet the information and education around this deadly disease remains fairly poor. Hello and welcome to our special series, Live Well with Diabetes. This is our aim, our endeavor to educate people about diabetes, its symptoms, its impact, and really the management of this disease. Today, we are coming to you from the IT city, Bengaluru, and I'm joined by a set of eminent doctors from the city. Our theme for today is going to be diabetes and its complications, especially related to heart and kidneys. Let's welcome our panel of doctors.
On our panel today, we have Dr. Arpandev Bhattacharya, a renowned endocrinologist from Bengaluru. Dr. Bhattacharya is a consultant at Manipal Hospital and is also the director of Shiva Jyoti, a clinic dedicated for the treatment and research of diabetes and endocrinology. Also on today's show, we have Dr. Mala Dharmalingam, a leading endocrinologist from Bengaluru with decades of experience in the study of diabetes. Dr. Mala also teaches endocrinology at leading hospitals and medical colleges. And lastly, we have Dr. C.S. Dwarkanath, a senior endocrinologist from Bengaluru. Dr. Dwarkanath is a consultant at many reputed hospitals in Bengaluru and has been practicing endocrinology for the last 2 decades.
Welcome, doctors. Thank you so much for being with us on the show today. Let me open this discussion first with you, Dr. Mala. Just give us a sense of what diabetes actually means. It's a term that almost each one of us has, of course, heard in our lives. But for our lay viewers, break that down for us. What exactly do you mean by diabetes, and which are the critical organs that can get affected by this deadly disease?
So diabetes is a disease where the glucose, commonly called sugar, is high in the body. For this, you have to understand a little basics of the pancreas secreting insulin. Right. Insulin is like a key. It digests the glucose to form energy, which is very important for us. What happens in diabetes? There are 2 types, type 1 and type 2. Majorly, we are talking about type 2 diabetes. Right. The insulin that is in the body is less, and also that what is there is working less.
All right. So let me get in Dr. Dwarkanath at this point, and she did mention micro and macrovascular complications, but if you can just elaborate on that a little bit, what are the complications that uncontrolled diabetes can really cause?
Predominantly blood vessels are affected. Microvascular, which involves smaller blood vessels, arterioles and capillaries, and big vessels. Both are affected.
Yeah, so literally every organ of the body is affected by diabetes. And Dr. Bhattacharya, what sort of a correlation exists between diabetes and cardiovascular diseases? Can you elaborate a little bit on that for us?
Well, heart is very important organ, as you understand very clearly, not only the people with diabetes, but also people without diabetes. But the fact remains that in people with diabetes, our 3/4 of the people, so around 75% of the people, the mode of exit is actually a cardiovascular system, or if you broader sense, the cerebrovascular systems. If you see, we call it atherosclerosis. The arteries, they get stiff, so they don't supply adequate amount of the blood, and we are mainly talking about heart and the brain, of which heart is more important. Now, there are several reasons will be there for which the heart disease is more common in people with diabetes than without. It is around 2 to 4 times. Most of the scientific studies tells around 2 to 4 times more chance of getting a heart problem, which mainly in terms of heart attack. So other than a diabetes, other compounding factors are there. For example, high blood pressure, high cholesterol, obesity, lack of exercise, smoking, all of them, they make more prone for development of the cardiac problem in people with diabetes. And here I'm mainly talking about the type 2 diabetes.
Right. Dr. Mala, how common is the prevalence of coexisting heart disease as well as diabetes, and how does that really complicate the things for the patient? Because you know, a diabetic patient, diabetes in itself is tough to deal with, but once one develops a heart disorder as well, what should one watch out for? Would you like some?
In fact, it's very interesting. Usually people think that women don't get heart disease, but it is 2 times more prone in men, while in women it is 3 times more prone. Actually, there is a gender differences even in that. Right. So this and if you look at mortality, when we say mortality and morbidity, we mean the outcome, how long they will live and things like that. They find that it is worse when you have cardiovascular disorders. So 3 things could happen in diabetes. The blood flow could be less, the pumping could be less, the muscles itself can be damaged. The problem about this is also that women, as you well understand, never go to doctor if they can avoid it. And the symptoms in women are much less. They would not have the classical pain that we usually say is associated with a heart attack. It may be just shortness of breath, some shoulder pain, which they will tend to neglect, or maybe some gastric, and they will think, oh, nothing, it's just some common problem, and they'd go on with their life. But that in a woman could actually translate to having a heart problem.
A diabetic patient is more prone to develop myocardial infarction or various cardiovascular diseases. And another peculiarity is, like a normal person will have some typical symptoms like chest pain in the middle, radiating to the left, he may have sweating, he may have breathlessness. All that may be absent in a diabetic. Right. It is a silent myocardial infarction, and various other symptoms are quite absent. So it may be some vague chest pain, a vague, you know, what he can consider as a gastric problem, or some vague pain in the back, or mild breathlessness. So the symptoms are marked. So the patient waiting for classical symptoms may be too late in many patients. Whenever there is a suspicion, it is always better to rule out this problem, and especially in those chronic patients who already have established coronary artery disease, it is preferable we rule out.
So even if there is the tiniest sort of
yes.
inkling, then one must
yes.
see a doctor.
Yes, at least he should meet a doctor, see that this thing is ruled out.
Right.
So we have the annual ECG. Every year, once a year, every diabetic should do an ECG, just like Dr. Dwarkanath was pointing out. And definitely, if he has some symptoms, he should not neglect, and he should go to the doctor and get one ECG done.
Right, right. Dr. Bhattacharya, what extra precautions should a diabetes patient be taking in order to avoid any sort of future complications?
I think rule of thumb will be tackle the problem a bit early. So as you understand, it is a long-standing process. So longer is the duration of diabetes, more and more will be the problem there. So it's very important that you diagnose a bit early. We start getting the control early. And in this point, I would like to divide into 2 points. One is the glucose control, and one of the other things. So that's what together we tell as a holistic approach. Glucose control is very important. Whatever the target, and it depends on, target depends on a lot of other factors. For example, how old is the patient, what are the other problems, what are the socioeconomic background, how much affordable they are. In our country, it's very important.
Right.
Other than that, it is very important that we maintain our weight, which is justified for the height. We do some exercise. A current recommendation is to do at least 150 minutes of exercise in a week. So which means at least 30 minutes of, say, brisk walking per day for at least 5 days a week.
Right.
Avoidance of smoking, avoidance of excess alcohol, more than medically permissible amount, control of blood pressure to the target. At this point, we telling target should be less than 140/90 for people with the diabetes. Control of lipid profile. All of them together to protect the heart will be the treatment.
And Dr. Malla, are there also dietary restrictions that a diabetic who, particularly a diabetic patient who has heart diseases, must keep in mind?
See, all this question is oft asked and very troublesome to the diabetic patient. They definitely think that my life is different and my diet is going to be different. So actually, there is nothing called a diabetic diet. It's a healthy diet.
Right.
So you should have, people should understand the concept of carbohydrate, protein and fats, and they should see that their food comes from there. So the carbohydrate, we Indians are basically carbohydrate eaters. Right. So we should restrict our carbohydrate to something like 50-55%, and the rest can come from protein and fat. Now recent studies have also shown and been published very recently that the fat and the protein are very important components of our food, which is, earlier we used to think fat is something which we should avoid completely. Right. Now it says that you need not avoid, but you should take it in the right proportions. So if someone understands this, yes, of course we ask them to avoid the saturated fats, because the cholesterol which actually gets deposited in the arteries is made of fatty streaks. So we ask them to avoid saturated fats. For animal fat, especially red meat, we do ask them to avoid. Otherwise, any good diet is good. But coming forward, if he has blood pressure, a little low salt goes a long way. And I would reiterate what Dr. Arpan said, that more than sugar alone, it is very important to control the lipid profile. That means cholesterol, LDL cholesterol. People don't have the concept of LDL cholesterol. They say, oh, I did my cholesterol, it's fine. They need to do the lipid profile, see that it is controlled, and also the blood pressure should be controlled. So if they do that, I'm sure they can, to a large extent, prevent cardiovascular disorders.
And also, additionally, whenever these people come, we start the discussion of trying to convince the people that 3 headings the diet should be taken. One is timing, one is quantity and quality. It's very important they eat in the meal in the right time, not dinner very late. Right. In between meal there is a snack. And if you are overweight, automatically your quantity of the calorie need to come down. They need to understand that. But a lot of time we see the people who are not overweight, they are also restricting their calorie too much. That's, at the long run, you'll make it become more malnourished. It will not be beneficial for your overall health.
Right. So one must eat according to one's body composition and height and weight, and the calories required on a daily basis.
Moreover, the role of stress also has to be kept in mind.
Absolutely.
And maybe with all recent stressful life, maybe some measures to reduce stress may go a long way.
Right. Sure. All right. So on that note, we are going to take a quick break, but stay with us, because on the other side, our panel of expert doctors here in Bengaluru is going to be talking about the impact that diabetes can have on kidney function. You are watching our special series, Live Well with Diabetes. Welcome back. You are watching our special series, Live Well with Diabetes, and this time we are coming to you from Bengaluru, and I'm joined by a set of very eminent doctors from the city. Dr. Mala, in the last segment, we spoke a lot about heart and its correlation with diabetes. Let's talk a little bit about kidneys now. Can diabetes adversely impact our kidneys? What exactly happens?
So, as all of us know, there are 2 kidneys. And this kidney, there are almost some small units called nephrons. There are about 1 million nephrons in each kidney. And this has each of these nephrons has a small filter called the glomerulus. So this is where the problem happens for the kidney, the filtration. The kidney is known to filter all the good things it takes back and the bad things it will throw in the urine. But unfortunately, what happens, because of the microvascular problems that Dr. Dwarkanath spoke, this is damaged and the kidney starts excreting albumin. So that is the first thing that happens most of the time in the kidney, where there is leakage of albumin. In the initial stages, it's called microalbumin, which is a special test which we recommend patients do so we can detect it early.
And how often do diabetic patients develop kidney diseases?
Some studies have shown that up to 40% of all diabetics may have kidney disease. So we are really looking at a huge problem. So if you're looking at 69 million people with diabetes in India, you can well imagine the load of diabetic kidney disease.
Right. The other side of statistics is there, if some dialysis unit, if you go, people with the kidney disease are getting dialysis, 50% of them will have diabetes.
Yeah.
Okay.
So half of them will have diabetes.
True.
Right. And Dr. Dwarkanath, what are the early and late signs and symptoms of kidney diseases arising out of diabetes?
As I said, the same thing as in the heart. Kidney, these diseases, they are very silent. Initial stages, when the filtration is getting decreased and the kidney function is gradually deteriorating, there is always a compensatory element, and biochemically we cannot make out. only when we do special testing we can make out. Patient will be asymptomatic. Only when he loses a significant proportion of his kidney function, then he starts having function. It doesn't mean he developed kidney problem only recently. What was going on from last 5 to 10 years is being exposed now. So initial symptoms, initially when the kidney is 10% affected or 20% affected, we may not have any clinical signs or symptoms at all.
Right.
So we will have to do the detection. We will have to screen for this complication, and if it is there, there are methods of either stopping the problem at that point or even reversal in some cases, so that we can prevent those complications.
All right. And Dr. Arpan, how can the kidneys be kept working for as long as possible? How can one delay the onset of kidney disease if one is a diabetic patient?
I think the first thing is will become patient education. We need to people make understand from the day one is that diabetes is just not a blood sugar value a printout. We need to see that all organs corrected.
Right.
So routine checkup, whatever we recommend, is two things are very clear. One is the retinal photograph and one is the kidney function. And kidney function traditionally we are doing by urine microalbumin and blood creatinine. Obviously there are other tests are there.
Right.
So for the protection is concerned, again the same thing will come. A very good diabetes control, a very good blood pressure control, and this is one of the area actually very funny, but some studies showed that blood pressure control in people with the diabetes to protect the kidney is more beneficial than diabetes control. So it's very important people's BP is correctly controlled, lipid is correctly controlled, and sugar is correctly controlled. And a regular follow-up done. Most of the time we are telling to do annual checkup, but probably every 6 to 9 months checking microalbumin and creatinine will be a very good option.
All right. So as we wrap up, I'm going to ask each one of you for tips and suggestions for people who are battling diabetes. How can they really live well with diabetes? Dr. Dwarkanath, let's start.
Well, what I would like to tell a diabetic patient is, now that you are diabetic, first and foremost, see that your blood glucose levels are maintained at appropriate your situational level.
Right.
At the same time, look at other factors which might precipitate your complications. One is control your lipids or screen for them. Look at the urine protein, see whether any problem is there. Get a regular eye check so that you can take measures to prevent blindness or visual loss. So see that you not only control sugar, you look for other complications, and if you detect it early, we can always prevent it.
Okay. Dr. Mala, what's your tip for living well with diabetes?
I think patients should diagnose their problem early. There is something called the legacy effect. That is, if you diagnose early, you can prevent complications. So prevention of complications, whether today we have talked about the heart or the kidney, is very important, and it can be done. But we need the cooperation of our patients because the onus of control of diabetes, blood pressure and lipid is on them.
Absolutely. Dr. Arpan, your final tip for patients who are battling diabetes?
I think my comment will be pretty crisp and sweet, that control your diabetes, don't allow diabetes to control you.
All right, that's very well said. Thank you very much, doctors. It's been a pleasure talking to you. Well, hope you enjoyed those insights and hope those insights help you battle diabetes better. We'll be back next time with another set of doctors from another city. Till then, thanks for joining us. Goodbye.
Focus, ideate, innovate, enable.